use our website. Okay.
Okay.
Welcome to another edition of Moore's Speaking Truth to Power related to issues in our community that can help people in various areas. My name is Jamal Binding. I'm your host today. And this is a series of events that we're providing to the community about helping them understand and deconstruct various organizations, issues, and topics related to helping people go forward. Today in our interview today, we have today is Gina Landsperger, who has a background in healthcare, and she received a Bachelor of Science from Mount Marty College in Yankton, South Dakota. She has a Master's in Science degree in nursing from the University of Nebraska Medical Center in Omaha. And she has over 15 years of experience working as a nurse and a nurse practitioner. She decided it was time for a career change when she realized the only time for her next career was to meet two objectives. And one of them was she had to be able to continue to help people. And also she wanted to provide an opportunity to serve the community. And so she saw a great need in working with helping retirees walk through the whole Medicare system, or we'll call it a maze. And she became kind of an assurance agent that specialized in Medicare and fulfilled some of her objectives in helping to meet this need. I met her when I was working on signing up myself for Medicare, which is a very dysfunctional system, confusing. And again, if you don't know much about it, you almost have to do a lot of homework. But she was very good at helping me walk through that, me and my wife. And so we really was happy what she did and decided to ask if she would want to share more of her expertise and knowledge with our community and our viewing audience. Welcome to the program, Gina. And again, we're happy you can help us deal with Medicare and helping people, particularly of color and low income, understand that system and how to walk through it. So before we get heavy into the interview, I would like for you, Gina, to share a little bit more about yourself and who you are.
Well, thank you, Jamal. It's really a pleasure to be able to talk with you today and help people. I have grown up in rural Nebraska, lived in Nebraska my whole life. I feel like I maybe was born a generation too late. I enjoy being outside. I enjoy baking and gardening, and just helping people gives me a lot of pleasure. And I'm so thankful that I found this niche to be a part of and to help me fulfill those goals.
Good. Now, many folks don't understand the difference between Medicare, which is what we will be focused on today, and the older topic is Medicaid. Can you provide a brief overview of the difference between the two?
Sure. People get them confused quite a bit, actually. They do sound alike in their name, but they are two very different programs. So Medicare is a program that's funded by the federal government. You pay taxes in your entire working life to receive this as a benefit. And it's actually only available to those who are over the age of 65 and those with disability. Once you've been on disability for 24 months, you can receive Medicare, or people with certain medical conditions, such as being on dialysis or Lou Gehrig's disease. One nice thing about Medicare is it's very portable. You can travel all over the United States and go to any doctor or hospital that accepts Medicare and be covered. Medicaid, on the other hand, is a state program, and you actually have to be needy and have depleted all your assets to be a part of that program. People of any age can be a part of the Medicaid program, but it's a smaller network. Since it is a state-funded program, you can only see providers in your state, and they must accept Medicaid, and not all providers do.
Okay, good. Now, what do we as senior citizens moving from work-sponsored programs need to be about or learn about to transition from Medicare to this part A and B? And a lot of us don't know the difference between A and B and also that transition. So give me a little bit more information about that.
Transitioning to Medicare can be quite difficult, and they are working on improving that. The first thing to do is determine when you plan on leaving the group coverage. Some people leave right away when they turn 65, and others decide to work past 65. And as long as they work for a larger employer, meaning that they have more than 20 employees in the group, they can continue on that group coverage and not have Medicare. But those who work for smaller employers must receive Medicare. And so if you receive Social Security benefits 4 months before your 65th birthday, they're going to go ahead and send that Medicare card in the mail to you automatically. So you're automatically enrolled in Medicare. But if you aren't receiving benefits, you're going to need to enroll in Medicare, and that can be a bit confusing. So you typically sign up 1 to 3 months before you turn 65 or before you leave group coverage. And you actually don't go to the Medicare website to do that. You go to Social Security. And the reason for that is that Social Security has to verify that you've worked long enough and paid into taxes to receive Medicare Part A for free.
And go ahead, sorry.
I was just going to say, sometimes the hardest part of this is creating the Social Security web logon. It's not always easy. The questions can be a bit challenging when they try and verify your identity. Or you can also call the local Social Security office. They open to in-person visits in April again, and that has been helpful for a lot of people who aren't that great with the computer.
Mm-hmm. What I was going to add to that is, in my situation, I had to go back and prove that I had insurance with my employers before I left. And then the other issue is my wife had, she was a bit different. I had to prove she was on our system. And it took us almost 2 months before we got into the system, even though I thought it was going to be like a 2-week process. So your point, Gina, of getting involved well before you leave your job is extremely important, because I think that's an issue. If you're having ongoing medical needs, that you need to have those insurance cover costs or whatever, so that you're not caught out there in that limb and you have to pay for it out of your own pocket. So great point there. Switching up, I'm going to ask you a little bit more. Why do people pay different amounts for supplemental care in these different systems? And obviously, when you alluded to, or when we talk about the introduction, you work as an independent person, so you know about the different systems. But why don't we just have one payment across all system providers who deal with Medicare in terms of Part B?
So there are various different costs for Medicare. One thing to know is that everybody will pay Part B of Medicare, and that's the $170.10 that you pay per month to have that coverage. There are some people who are lower income who can have the state pay for that Part B. And then there are others who are higher wage earners who actually pay quite a bit more in some cases for their Part B. And then on top of that, there are 2 different options when you go into Medicare. You can choose Medicare Supplement to help cover your out-of-pocket costs that go along with Medicare, or you can choose Medicare Advantage. Those are private insurance companies that provide your Medicare coverage for you. So an example of Medicare supplements, the plans are standardized. So Plan G is the most common Medicare supplement plan, but one person might pay around $110 for a Medicare supplement Plan G, and the next person could pay $150 for that exact same coverage. The reason that for those differences might be the zip code that you live in. Certain areas pay more, and that's typically based off of claims. A younger person who is new to Medicare will have lower premiums than someone who's in their 80s. And actually, after age about 68, the rates of the supplements go up quite rapidly. There are 3 plans in our area that are Medicare supplements that are pretty typical. Plan F covers all of your out-of-pocket expenses, and that's going to be the most expensive. All you pay is your premiums. Plan G covers everything except for the Part B deductible, which is $233. Typically, that is what people choose. And then Plan N, if you assume just a small amount of risk, you can save about 20% on your out-of-pocket expenses. And not everybody's going to tell you about the Plan N. And then I guess I already said the companies vary in price. And the reason for that is one company may only have 500 lives in Nebraska covered by the plan, whereas another one may cover tens of thousands of lives. So with the companies that have larger numbers of people on the plan, they're able to better spread their risk across more people. And then the other option would be the Advantage plans. Each plan is different because it is administered by a different insurance company. If you go to the doctor, sometimes plans will have you pay $0 and another plan might have you pay a $10 or $20 copayment. And then other plans have a lower out-of-pocket maximum, such as $4,000. And what that means is all in, that is the maximum amount of money you'll have to pay in copayments and coinsurance for the year. And another one might have a $6,000 maximum. So those are important things to look at when you choose your plan. The amount that you pay for the copayments depends on how the plan is performing. If they're losing a lot of money, you can expect the next year the copayments and coinsurance are going to be higher. Medicare Advantage also, they built in their prescription drug plan, so you don't have to pay an extra premium as you would if you had a Medicare supplement. They also provide dental, vision, hearing, and sometimes over-the-counter supplies at no extra cost. It's not full coverage, but it at least helps with your out-of-pocket cost. But you must remember that these are managed care plans. So the insurance company can say, you know, you need to have physical therapy before having your knee replaced, or they may deny a service and you have to have that appealed. So those are things that you need to know going into it. It's similar to your current employer plans. And these also are pay as you go. So people who are healthy and not having a lot of health needs are very, very happy on these plans. They're enjoying their gym memberships. They're getting their dental checkups and new glasses. But those who have more health needs are maybe not so happy because it's hard to budget. They may have a $0 premium, but if they have a hospitalization, it may cost $1,200. And it's hard to budget $1,200 for 1 month when you've been used to paying your $10 a month. So,
you know, one of the things is you were talking about these different plans. For someone who's a novice who never done this, it can be very complicating and daunting in terms of not understanding this. So it's very important to have, obviously, the Social Security and some of the plans give you written material, but some of us come from an oral tradition is you have to tell us, or we can hear you say this and articulate in a way how you do the steps. It's very important of those cost differences. By the way, I do notice that Social Security or the Medicare, they charge $170, you say, a month. Is that standard? Does that say the same all the time through the year?
that's a good question. It does go up every year. We saw a huge jump in the last year. And last year in 2021, the premium was $144.50.
Wow.
And then it jumped up to $170.10. And the reason for that is there's a new Alzheimer's drug named Aduhelm. I know I did not pronounce that correctly, but that costs $56,000 per dose.
Wow.
So Medicare raised their premium for Part B based off of that anticipation of the drug being approved by Medicare, which it hadn't even been approved when they made that rate increase. And in fact, the drug is not prescribed as widely as they anticipated. So Medicare is looking to maybe adjust their premiums based on that.
Which I find so much strange because there's some people who may not need it, and yet they're, you know, gonna have to pay these higher prices that they may not be able to afford if they're living on just basic Social Security
Right.
income for that. So yeah, we need to be conscious of that. And also, I think that's where you get elected or public officials to these conversations, because again, some low-income families can't afford to pay higher than what they normally pay. And years ago, when I talked to one of my older friends, he told me he was paying like $130 a month, and it was really manageable for him. But again, as you lose some people don't have pensions, that could be an issue that we have to deal with.
It is.
You live in one of the smaller towns in Nebraska. I didn't say village, but I said smaller towns. What difference have you noticed as opposed to people who get services or coverage in bigger cities such as Omaha and Lincoln? Is there any difference in rural communities versus urban areas?
So one of the things that I've noticed, because I do work in both the rural and urban areas, is I've noticed the plan choices that they have or that they end up making. So in my rural area, I notice a lot of people purchase supplements. And I don't think that it's that they necessarily make more money. I think that it's just that the Advantage plans did start in the cities and are making their way out to the more rural areas. And then another theory is that the networks, if you are in a Medicare Advantage plan, you have to make sure that your doctor or provider is in that network. And since most of the care is centered in the urban areas, I feel like they maybe have a little bit more options as far as networks. Whereas with the rural area, you may have your one clinic in town, if you even have a clinic, and then you need to make sure that your doctor accepts that plan. So with the supplements and Medicare A and B, you can go to any doctor or any hospital that accepts Medicare. So it's really easy. You don't even have to look into your provider being covered because most doctors and hospitals accept Medicare. And I do find, oh, go ahead.
No, I was just going to say, one of the things that also related to this is I went back to visit Hastings where I was born, and the hospital or the place where I was born is now a regional hospital in that area that covers area. And you got Grand Island and different places. So in some rural communities, the smaller places that we know of as a hospital or healthcare may have dissipated or disappeared. And then there may be a larger institution that covers the larger areas. But I do know it is a challenge in rural areas in terms of traveling. But yeah, it changes, as you just alluded to, based upon the population and what's available there. But go on, I interrupt you. Go ahead and share more.
Oh, that's the next thing I noticed is that rural people are willing to pay more to go to a specific pharmacy. And maybe it's because they know, or they've known the pharmacist since they were a child and they're willing to pay more. And in my area, we even have a pharmacist who will help you pick out the drug plan for the year.
Oh, wow.
So, yeah. So that's just one thing. I feel like they have a connection with the people that help them out that they're seeing when they pick up their medications. I don't see so much mail order pharmacy in the rural areas.
Wow.
And then Medicare does have, the Medicare Advantage plans also have plans that are designed specifically for people who receive both Medicare and Medicaid, because you can have both. And when you have Medicare and Medicaid, the state actually pays your Part B premium, that $170.10. And these Medicare Advantage plans come with all kinds of extra benefits for these people. They have higher dental and vision and hearing benefits than an average person can have. And then they also have, one of the popular plans has a food card where you can go to Walmart or whatever grocery store you want, and you actually scan your insurance card, and they take anything eligible for purchase with that card off of your bill, and then you pay with your regular payment. These plans, actually, people are very happy with them and they really like them. But people in the rural areas aren't so excited to sign up for that type of a plan.
Mm-hmm. You know, as you alluded to that, I remember my mother was on, before she passed, she was on Medicare and Medicaid. And I remember when there was a snafu or some mix up and they took her off to get a prescription. It was crazy. We really couldn't afford it. It was supplemental, like Insure or something like that. And so we had to wait a month to get her back on. But I was surprised how much some of the medicine and supplements and things cost. But Medicare took care of it because, again, she was low income. My question, do you have to be low income to be on Medicare? Is that only for people who are near the poverty level or something like that? Do you know?
So the Medicare is available to 65 and older, but Medicaid is the one that you have to be lower income, and you get the extra help with paying for your medications.
Okay.
And you have to, there's certain income limits, and then your assets need to be less than $4,000 for a single individual.
Assets, could we also include the house, you mean, or the car?
No, assets are just any savings, checkings, retirement. You are allowed your house and one vehicle. So those aren't counted toward your assets.
You know, as you mentioned that, the other thing that came to mind, I was explaining this to someone, we had this conversation, is homestead exemption. They
Yes,
consider
yes.
your income level. So if you're a lower income, you can get your taxes abatement in Nebraska based on your income. But if you have a decent pension and you got a certain whatever amount of income coming in, you won't get that certain percentage off or whatever. So in the case of my father, who's still alive, his 90th birthday yesterday, in his house, he would pay nothing because he's had very limited Social Security that's coming in. And most of us don't know that. And I don't say that to embarrass or say it, because there are a lot of low income people that I learned when I was teaching a class on poverty who leave money on the table that they could benefit their family, whether it be food stamps, the social services program. I also discovered in rural areas, sometimes people don't want the stigma, so they don't always know that. But again, these are government programs like any other programs that people pay taxes to help support people in the country. So we need to just be conscious of that. There are opportunities. If you learn more, you may be able to get more benefits, particularly after you worked all your life and put money into the system. So very important concept. One of the things that I like to do, and it's part of my style, is I like to use the magic wand metaphor. You know, if you had a magic wand, wishful thinking, so on. What would you like to see changes in this program for many people, and particularly people of color or low-income families, that people without decent incomes or pensions who may depend exclusively on their Social Security? So from your vantage point, what can we do to tweak or make the system better to help more of people of color and low-income people to access some of these services we're talking about?
Well, this is really wishful thinking. I feel like the focus is just in the wrong place. When you look at healthcare and when you look at insurance, I feel like the focus is always on the profitability or making money, when it really should be on taking care of the people and making sure that their needs are met and that they aren't having to choose between eating or having electricity, heating their home, or receiving healthcare. So I just feel like we need to have more of an awareness of the programs available. I know we've spoken a little bit about Medicaid and the homestead exemption. Another program that's really less known is Extra Help, and that's a program that helps pay for medications out of, it'll help pay for your medication Part D premium. And it also limits how much you have to pay out of pocket when you fill your medications. So you aren't making that choice between, am I going to eat today or am I going to take my medicines like a blood thinner so I don't have a blood clot and have a stroke? I think that there needs to be more awareness of these programs. And that's why I do focus a lot on education, and I'm screening my people as they come to me for help, just to make sure that they don't qualify. Because if they do, we're going to apply for those. We're just going to take the extra time and knock out that application and get them the help that they need. So, and I feel like everybody needs an advocate like that. And if more people could step up and just help.
Yeah, I interrupt you, so go ahead.
No, I'm finished.
Gina, there's something that hit me as you were talking, and again, I was thinking about my experiences teaching at Nebraska Methodist College, where I saw some students with sharing with me years ago, and I'm sure it happens even today, how much it costs in drug costs and so on. So in other words, if you have a heart condition or certain kind of complicated health issues, you could pay a tremendous amount for your medication, and that can also be an issue. So when you just alluded to some programs can help do that, is that program affiliated with the government program, or is that something with the state, or both?
It is, and it's actually administered by the Social Security Department. And each May, the Social Security Department will send out a letter to people who they've identified that qualify for the program and aren't enrolled. And I feel like that is a letter that could be overlooked. I actually had posted something on my Facebook page last month about that, because I want people to know about these programs and to watch their mail for these letters.
You alluded to earlier as being an independent kind of contractor type. What's it between you and someone who works directly for a major healthcare entity or organization in our town or whatever? What's the difference between your job duties or whatever?
So the difference is I'm independent and I represent all of the major carriers in the area. So I'll shop around and I'll look for what's going to give you the best rate. I also look and make sure that if you choose Medicare Advantage, that your doctors and all of your providers are in network. Whereas if you call a larger insurance company, they're going to sell you their product. And I can think of an example of someone who retired and joined a Medicare supplement plan, and they also sold them their prescription drug plan. When at the time that he was retiring, the drug plan was probably around $30. Well, probably 5 years later, he came to me because his wife retired and his drug plan was going up to $82. He didn't look at his annual notice of changes, which is a letter that's sent out in the fall to tell him this. So when I saw his wife, I said, your husband needs to come and see me because he's going to pay $82 a month for that drug plan. And then come to find out, each medication was going to cost at least $10 to fill.
Ooh-wee.
And we shopped a drug plan with another company that was going to charge some medications he could fill for not anything. And he saved about $2,500 he will save $2,500 this year.
Wow.
Yes.
I think what's also fascinating related to that is I went to get my prescription. I'm not going to mention the company, local place, and it was free. And I'm like, what? Are free? How come I didn't get this earlier? In other words, there's certain drugs that, again, is a certain age is part of the system, and you don't pay. And I was surprised because I've never had free drugs. I mean, prescription drugs. I'm being funny there, but drugs where somebody said, hey, you don't have to pay because you're in this system. But it was very fascinating just to see that happen. But again, those are one of the benefits of being in this Medicare program is there's some drugs that are part of the system and they provide it to you directly free. So it's good.
And that actually depends on your current drug plan. And that's why it's important to change or to look at your drug plan every year because it could change for next year. And that's why October through December, you'll want to shop your medication plan.
By the way, is there exceptions to that window? Because I know in some programs, even the homestead exemption, if you don't apply at a certain window, they won't let you get it, even though you qualify. So is the same thing with this Medicare program too, that you have to do it within that? Do there are exceptions to that window of time?
So there are a few. So Medicare has a lot of rules, and it's hard to keep track of all of those rules. When it comes to your drug plan or when you have Medicare Advantage, your drug plan is built in. All of those plans change year to year. So they have a time period, October 15th through December 7th, where you shop your drug plan. And that's when you want to make sure that all of your drugs are covered by the plan, all of the doctors are covered by the plan, and any change you make will take effect the following January. There are some cases where you can make changes outside of that window. And those instances would be if you're on Medicaid, you can make a change every quarter. If you're on extra help with Social Security, that's the program that helps pay for your drug plan premiums and medications when you fill them at the pharmacy. Those people can also make a quarterly change if they want. And then trying to think, there was one more. Oh, if you live in like a nursing home, you can make a change monthly.
Oh, wow.
So,
well, new information. Good.
Yes. And there are other maybe less common instances, but those are the main ones.
One of the things that there are many providers in terms of this program, is there someone in place in the state government who can help people deconstruct to make sense of these confusing systems?
So there actually are a couple different programs. The SHIP volunteers are people who help a large number of seniors navigate the Medicare maze. They'll help provide Medicare education. I do know they have some online education that teaches you the basics about Medicare. And then they also can help you pick out a plan, just like me, that makes sure that your medications are appropriate. They can give you rates for different insurance companies if you wanted to shop, but you would need to call the insurance company directly to enroll with them. And then there's other nonprofit volunteers or programs in the state and in the cities, like the ENOA, the Eastern Nebraska Office on Aging. Those are other people that can advocate. They have resources where they can refer people on to the correct entity that can help them. Mm-hmm. And then as far as affordability, the state Medicaid office is a great resource. If you're someone who has limited resources and aren't sure if you'd qualify for these programs, you can always call the Medicaid office and they can walk through an application with you and help you see if you would qualify. And then I had mentioned the extra help program with Social Security with medications. You can also call Social Security and ask about that program or find it online.
Now, Gina, when you say Social Security, we talking about Social Security on the national level or the local Social Security in your area, or both?
Actually, you could call either of those numbers, and I have had a lot more luck with receiving help when there's been an issue calling the local office. So that everyone I've spoken to has been very helpful and patient, and someone may not have all the information and they help kind of walk them through to find the answers. So the Omaha office has really been great.
You looked at that. One of the things that I found disarming or alarming or negative was the wait time. You would think that the government, particularly the federal government and senators and Congress people, would make sure there are enough staff members, because you shouldn't have to wait 15 or 20 minutes, particularly on the national level. But again, I found it strange, and a couple of times I actually got cut off, so I had to start all over again. But yeah, you would think some of these offices, whether it be Postal Service, Social Security, you name it, they would have an adequate number of staff, and you would have to wait 15 or 20 minutes just to get a simple question or whatever answered and so on. Switch it up a little bit. This is a little bit different. And I'm going to ask you kind of like, what do you find most satisfying about your job? You seem very enthusiastic, but what do you find most satisfying about what you do?
I like the satisfaction of being able to help people, and also just saving people money. I don't know why that brings me so much joy. I think it's just because that with times being tough right now, everything's costing more. A couple examples this week is I help some people under the age of 65 with health plans. They're kind of in a pickle and have a really, really short window to find a resolution to no healthcare coverage. And one person that I had talked to had some serious health issues earlier in the year. And we were talking about medications on this new plan we were looking at. And I said, oh, you don't want to use your insurance to fill this medicine. You can get a coupon. And I sent him the links and the prices for these medicines with the coupon. And he said, you're kidding me. And I said, no, this is real. Anybody under the age of 65 can use these coupons. And a medication that was costing him $200, he could get for $25.
Wow.
And he could not believe it. And he even texted me later on in the night. He's like, my kids, thank you. I can't tell you how grateful I am for this help. And I had the same instance with another person who they just were, sometimes I wonder that people don't take the extra time to say, hey, you can save money in this area. They don't make money off of it. I don't make any money telling people you need to use this coupon. I just do it because I know how much money it can save. $175 a month is quite a bit.
Wow.
I mean, you could. So just seeing how relieved people are and grateful that they understand their care and their coverage and not having to worry about it. They can go to the doctor with peace of mind, knowing that they know how their plan will work and what their responsibility will be.
I appreciate that. Appreciate sharing that. Another thing it brings to mind is I have an old truck. I used to have an old truck sitting in front of my house, and one day somebody drove by and hit it. And looked, they were going to drive away, and my neighbor said, you need to go and knock on the door and figure out what's going on, what you did. So the person came to my door and basically reported that they hit my truck accidentally. It was parked on the street. And at the end of the process, I was able to get some money out of the dented truck and so on. And I would go across the street to give my neighbor, a little share of the money that was reimbursed by the insurance company for hitting my truck. And my neighbor says, no, I don't need the money. I'm your neighbor, or something like that. And it was like very gratifying and rewarding that he did that. Now, again, he didn't have to do what he did, but again, that's what neighborhood is about. That's what neighbors are about. And that's what kindness is about. So I like to share that there are a lot of people in our society who will do the right thing and help people out. And we just got to get more of that going on, Gina, in our confusing time. So really appreciate you sharing that. I have no clue about the quality indicators of your job. And again, that's the same thing with a lot of nonprofits, business, you name it. And again, one of the things as a person who's interested in demographics and statistician is how can you or anyone measure your job effectiveness, and or what kind of numbers of individuals you serve in a given period? And I'm asking that because it's a general question that we sometimes ask of a lot of folks. How do you measure if you're doing a good job or whatever? So how do you do it in your line of work?
Well, it's interesting. I find that everybody, their level of success is different. One person, I've heard them say, might work a solid part-time to support their golf habit. Where
That's funny.
where I'm just trying to work full-time and help as many people as I can and support my family financially. So I look at it as, how many people did I reach? And one of the things that I've really struggled with lately is seeing the struggles of seniors with solicitation. A lot of them are lonely. They're picking up their phone when it rings. And if I'm not helping somebody because they're calling me and making an appointment to meet with me to sign up for a plan, what I'm doing is trying to find ways to educate people and hopefully prevent those things from happening, because it's not only the telephone calls, it's the commercials on TV who, if you call those numbers, they're going to transfer you to an overseas call center where they're going to try and sell you a plan. They have quotas that they have to meet. And it just makes me just disappointed. And
go ahead, sorry.
Oh, I just going to say, and mail too. You think mail might be safe. You'll get in a very official looking document or letter, postcard in the mail that wants you to fill it out and return it. And what you get in return is somebody calling you to try and sign you up for a plan. And not everybody is bad. The intentions of the person on the other end could be very, very good, but sometimes you just got to be careful and ask yourself, is this person looking out for my best interest?
As you're alluding to that, and one of the things that hit me is I know there's a conference coming up soon on elder abuse that this Department of Health and Human Services put on every so often, and I know it's coming up soon, but one of the things that's happening, we hear in the media, there's been a lot of cases of fraud. And it's like people, we have a landline and we get all these kind of solicitations, and they can go online and find how old you are. So they assume that some of us are feeble-minded or have Alzheimer's or any kind of dementia. So they take advantage of you. And I do know people who are rational people who sometimes don't always listen to their friends, but we got to be on the lookout for these opportunists who take advantage of the elderly or people who don't quite understand these systems. So very important to be on top of that. But also I think the state and government officials need to do a better job of policing or working on helping adults not to be abused. And some of the abuse is financial, taking advantage of people's financial pocketbooks and things like that. So again, I wish we could notch that up a little bit, because I think there are a lot of opportunists and craziness going on. And again, I like the fact that you say some of those overseas where they don't have to follow the laws of this country, but they do take advantage of the technology of doing that. So it's kind of good to sort of talk about that. If someone wanted to contact you and they wanted more information to get more in contact with you or to figure out how to get some valuable counseling or feedback about insurance, how would they do that? Through this contact information?
Yes, I have my contact information on the screen. You can either call or email me if you want to check me out. Before you do either of those, you can always check out my website. I hope in the future to be able to provide more information on my website that can educate people, because that's one area that I do need to step up what I'm doing, because a lot of times people are just looking for information and they don't want to worry about being talked into something. And I want people to feel like they are safe contacting me, and I'm not going to try and talk them into something that they don't want. I'm going to provide you with the information, and then I'm going to leave it up to you to decide what fits your needs the best.
Quick question, and I know you and I had this conversation, you work from home. How many hours do you put in? I mean, again, it could vary, I assume, but what are your hours like in terms of working versus working inside an office 8 to 5? What is it like for you?
Well, it is quite variable. Usually I'm in the office by 8, but I'm typically at home answering emails. This week I worked probably 8 to 5 the entire week in the office, and then I go home, I answer emails, I run quotes, I do homework. So, but each week can vary. I might have a week where, it's a little bit more slack and I can spend a little bit more time with my kids and my family and my poor neglected garden.
I like when you slip that in. It reminds me of the Energizer Bunny with this COVID-19. Some people have gotten so used to working at home, they don't want to go back to the office. They like the flexibility. And I remember years back when I had a job that gave me that. I can come in on Saturdays and put in the extra hours if I had to go for an appointment for my kids or my wife, whatever. The things that you have to do as a family. But I love it, the flexibility. But again, sometimes we forget that work-life balance. And that can be another thing that you get burnout or people just become workaholics and they think they're doing something, and in the end result, they can hurt themselves or their families by putting in too many hours. So again, that was a question. Gina, we're kind of at the end of the program, and I always like to give our guests a chance to have an opportunity to share any closing comments for our viewing, our listening audience.
Well, I hope that you found some good out of this and maybe took away some points that can help you or maybe a loved one out, save some money or find an appropriate plan. I am an independent insurance agent, so I do help people enroll in Medicare plans, and my services actually don't cost anything. If someone chooses to use my services, how I get reimbursed is enrolling them in the plan, and the insurance company will compensate me. And you don't pay any extra for that, and you would pay exactly the same amount as you would if you called the company directly. So it's not going to cost you anything more. What you're going to get is me as an advocate. I'm here to help you if you have questions about your plan. I can help walk you through things. And sometimes people just need a person to make a three-way phone call with them to their company because they can't understand the person on the other line, or they just don't know what questions to ask. So I'm here to advocate for you, because it's really important that you understand what you have and how your plan works so you aren't surprised later, because that's the worst thing is when you use your plans, it's typically because you've had a medical event, and I want you to have the peace of mind that you're well taken care of and your insurance company will take care of you.
Gina, I really appreciate you being on the show today and sharing this valuable information, and really learned a great deal myself. And I hope our viewing or listening audience can also benefit from what you've shared. So we hope to have you back again to talk about some other issues. So thank you very much for being with us today with more.
All right, thank you.
Hope you've enjoyed this edition of More. Join us again next time.